Now this group, proton pump inhibitors, they are all prodrugs. What do we mean by prodrugs? It means that these drugs have to convert into a metabolite to show some action. And you have to remember that proton pump inhibitors, they actually convert into an active metabolite not in liver but in the stomach and in the gastric glands where there is high HCl. So HCl is necessary for proton pump inhibitors to convert into an active metabolite, and then they can block the proton pump. So ultimately this group is more potent than H2 receptor blocker, and it takes about 24 hours and even 48 hours for new proton pump to synthesize. So all of the therapeutic uses are same as H2 receptor blocker. Because this drug is of longer duration of action and it inhibits almost 96% of the HCl that is being secreted, so the duration of treatment is 4 weeks and then endoscopy, and if there is improvement then it is 4 months as compared to H2 receptor blocker. Now if we talk about the adverse effects, some very prominent and important adverse effects that you have to remember is that prolonged therapy with proton pump can lead to vitamin B12 deficiency because HCl is required for its absorption, and this drug is suppressing the HCl secretion. Second most important point is that this group, because it is actually interfering with the normal physiology of HCl secretion, ultimately it's going to cause alteration in the bioavailability of many drugs that are dependent upon HCl for their action. And regarding omeprazole, there is a very dangerous interaction that occurs. Omeprazole, it inhibits the enzyme, as you can see in this figure, CYP to C19, and clopidogrel is a drug which is used in patients with ischemic heart diseases for inhibiting the platelet aggregation. It is dependent upon this liver enzyme, and if a patient is taking this proton pump inhibitor, ultimately clopidogrel is not going to act, and it is going to prove very dangerous for such patients if the drug clopidogrel is not acting. And patients who take again PPIs for a very long time, they are also associated with increase in bone fractures due to osteoporosis. This is because calcium is needed, or we can say the acidity is required for helping in the absorption of calcium. So when calcium is not absorbed in such patient, it might lead to osteoporosis and bone fractures. The next drugs that we are going to talk about are the mucosal protective agents. We will start first of all with sucralfate. This is a drug which is actually a complex of aluminum hydroxide and sulfated sucrose. As you can see in this figure, sucralfate, it actually binds to that necrotic mucosa of the ulcer and forms a coating, and it actually forms a physical barrier that protects the ulcer from direct contact with the pepsin and acid. And then now we are going to discuss about prostaglandins. Regarding prostaglandin, it is actually a defensive factor of the GIT. So prostaglandins, or we can say misoprostol, which is a part of this group, it is actually an analog of prostaglandin E, and this category is used for NSAID-induced gastric ulcers. Now what does this drug do? First of all, as we have studied that we have 4 types of receptors that are involved in HCl secretion, and one of them is prostaglandin receptor. Prostaglandin receptor was responsible for inhibiting the HCl secretion. So first function is to inhibit the HCl secretion. Then it is followed by stimulation of mucus and bicarbonate. So this is the cytoprotective effect of prostaglandin, that it helps in stimulation and secretion of mucus and bicarbonate that are going to play an important role in the defense of the mucosa. But one important thing is that misoprostol is actually contraindicated in pregnancy because it is used actually to stimulate uterine contraction. So it can cause miscarriage in pregnant females. And now we are going to discuss antimicrobial agents, as we have to keep in mind that one of the very important causes of peptic ulcer is H. pylori infection, which is a bacteria, and antimicrobial agent should be used to eradicate this microorganism from the GIT. So you can see in this figure the H. pylori treatment regimens have been discussed. We have triple, we have quadruple, we have sequential and combination products. Now for the successful eradication of H. pylori, a single antibiotic is not sufficient. So combinations of antimicrobial drugs are used to eradicate the H. pylori. So the first or best option is triple therapy. But in case if there is resistance to clarithromycin, quadruple therapy is indicated to eradicate the H. pylori.